Hi, Alicia Bright here again. We're going to apply the concept of immunity to people with immune suppression, people with allergies, and anaphylaxis. So, what do we find when we examine somebody with a suppressed immune function? So this is easier to identify than uh, an exaggerated immune response. So typically, you can tell if somebody has a suppressed immune function because they are having a lot of infections. They have poor wound healing. They're tired. They have malaise. They have weight loss. So these people look malnourished. They may have wasting syndrome. They may have chronic wounds and enlarged lymph glands. They may have opportunistic infections such as C. difficile or different kinds of pneumonia. Consequences from suppressed immune response include infection, which we've talked about, and we'll talk about a little more, and cancer, which we're going to talk about in a couple weeks. So we'll get into. So obviously, if you don't have a good, strong immune system, how do you fight an infection? That's what it's there for. But we're going to talk about how the immune system responds to cancer when we discuss cancer a little bit more. So collaborative care for immunodeficiency includes monitoring immune function, blood tests and so forth, as well as physical assessments. Nutritional support is helpful. Preventing opportunistic infection, so protecting patients from infection. Opportunistic infections, for instance, some pneumonias are opportunistic. Tuberculosis can be opportunistic, particularly in HIV patients. And so we'll monitor and treat these opportunistic infections. Thrush is another example of that. And then drug therapy, of course, antibiotics often are used. Exaggerated immune function is a little bit more difficult to identify. The symptoms include allergic symptoms, include pain, fatigue, fever. You might find people with mild allergic responses or severe allergic responses. Autoimmune disorders can start with really vague findings, but those conditions, as we'll discuss coming up, those conditions can be associated with organ failure, severe illness, and death. So some things cause mild allergies. Pollens are the typical example of a mild allergic reaction. A lot of people have experienced this. In the springtime, like we are having right now, the pollens come out and we start sneezing, we get itchy eyes, watery eyes, blowing our noses a lot. Those are, it's not life-threatening, it's just annoying. And then there's, for instance, latex allergies. The gloved hand in this picture represents latex gloves, which can cause allergic reactions, including a mild dermatitis or inflammation of the skin. Anaphylaxis is a different critter that comes from the same basic immune overreaction. There are different foods that can cause anaphylaxis. Peanut allergies are the scourge of preschools these days and elementary schools. Seems like we've got a lot more peanut allergies than we used to have. And allergies to other things, eggs, oranges, anything with protein could potentially cause an allergy. Latex gloves, again, latex in general can cause anaphylactic reactions. We're going to get into that a little bit with a case study in a little while. But this is why we wear nitrile gloves now, and we avoid using latex, even though latex is more comfortable and gives us better sensitivity. It also gives us contact dermatitis and anaphylactic reactions if we use them too much and we're susceptible to that sort of thing. Bee stings can be another example. People can have a mild reaction to a bee sting. It hurts and it itches for a while, or they can have an anaphylactic reaction and actually be threatened with death from a bee sting. So there are 4 general types of exaggerated immune responses. And type 1 immune response, That's your bee stings, your anaphylaxis. Your type 1 uh, reaction can be life-threatening. Type 2 can cause things like myasthenia gravis. This is a autoimmune disease. Type 3 can cause things like rheumatoid arthritis and systemic lupus erythematosus. We talked about RA last week. We're going to talk about lupus this week. Type 4 can be a contact dermatitis like poison ivy or latex allergy. Or it can also be associated with transplant graft rejection. So a type 4 reaction might happen if someone's not got the right amount of anti-rejection medications in their body after they've had an organ transplant. So acute hypersensitive reactions can be local or systemic. They can create destruction of body tissue, abnormal organ growth, and change in organ function. So what are we going to do about it? Well, the first thing we want to do is, if it's an allergen that's causing the problem, we want to remove the exposure, if at all possible. If somebody's got anaphylaxis, we're going to provide airway support. We'll get into that a little more. But the drugs that we might use for this would include antihistamines for a mild response, to reduce the response. Antihistamines are commonly given for allergies, sinus allergies, pollen, spring fever, hay fever kind of things. I guess spring fever is what I've got right now, wanting to get out of the house. Sympathomimetics. Sympathomimetics, it's a big word. It intimidates you a little bit maybe, but just if you think sympathomimetics, break it down a little bit. Sympatho, or sympathetic, like your sympathetic fight or flight nervous system. Mimetic meaning imitation. So something that imitates your fight or flight nervous system. That would be epinephrine, wouldn't it? Or other drugs that do that, but it's a stimulant, epinephrine. We might give mast cell stabilizers. We might give immunosuppressive therapy, and we might give anti-inflammatory agents, and all of those should be familiar to you from previous lectures. We might also give symptomatic relief with antipyretic medications, stuff that makes you not itch so much, decongestants, and analgesics. So if someone is in anaphylactic shock, what happens is there's massive vasodilation. The mast cells release the chemical mediators that open up the capillaries to perforation. The fluid goes out through the walls of the capillary into the tissue and creates swelling. This creates hives, and it can also create laryngeal edema. So the same swelling that happens if you get hives also can happen in your airway. This can cause flushing. Urticaria is hives. Angioedema is swelling around the neck and the face. Swelling of the lips can happen. People can end up with laryngospasm, bronchospasm, and circulatory collapse. So that's how you die of anaphylactic shock. Nursing care is geared towards making sure you don't die. So airway, breathing, circulation. We're going to give airway, maintain the airway. We're going to provide for intubation if necessary by having the right equipment around. We wouldn't intubate unless we're especially trained to do so, but we would support the person who is intubating. We'll provide oxygen, and we'll ready IV fluids, because that is what would counteract the circulatory collapse and also facilitate the administration of IV medications, such as epinephrine, that's that sympathomimetic we were talking about, diphenhydramine, which is Benadryl, or ranitidine, which is also called Zantac, and bronchodilators. Remember our favorite? Yeah, that would be albuterol. So those are the meds that we might use for anaphylactic shock. So ABCs are of the greatest importance for people who have anaphylactic reactions. But what we want to do in general is to try and prevent these things, these hypersensitivity reactions. So teaching, we talk to people about identifying potential allergens, identifying triggers. We talked about this when we talked about asthma a little bit, because asthma is often a result of a hypersensitivity reaction. So pollens, for instance, can trigger asthma. So in general, we want to help people identify potential allergens. If you've got hives, try and figure out what causes the hives, and discuss strategies to avoid those things. Sometimes cats, people are allergic to some kinds of cats, and if they had a different kind of cat, they might be less allergic to it. Same with dogs. My son has poodles because they are hypoallergenic, because he has allergy to dog dander. So we're going to do really good health histories on people and health assessments, physical assessments, and get their stories and kind of get a sense of what it is in their lives that may be causing these reactions so that we can help avoid anaphylaxis in the future. So a little bit of a case study now. BN is a 41-year-old female who is a dental hygienist who has several knee surgeries over the past 5 years due to a knee injury. She presents to the outpatient surgery department today for the last reconstructive surgery. Her past medical history indicates she had asthma as a child and one occurrence of contact dermatitis. She tells you she has no known drug allergies. You start her IV and give her a saline flush, and within 3 minutes, her IV site is itching, and then a few minutes later, she starts complaining that her throat is getting a little tight. What are you going to do now? So think about that. Think about what risk factors BN has as identified in this case study. There is a document posted on Moodle that has more detail, and we're going to play with that a little bit in our Zoom meeting on Thursday. So take a look at it and be ready.